Hi everyone, my name is Lauren and I just wanted to make a video today about my experience so far with weight loss surgery. So just to get started, I am a 25-year-old doctoral graduate student, which means I'm getting my PhD and I'm doing that in organic chemistry. So on 1/11/2016, I had the vertical sleeve gastrectomy with Dr. Eric Dutson at UCLA Ronald Reagan Medical Center here in Los Angeles, California. And I did a lot of research beforehand. I looked at a lot of video, watched a lot of videos, read a lot of forums, and I just didn't get the whole experience, I guess, which you never will until you actually experience it. But I wanted to make this video to hopefully maybe reiterate the points if you're nervous, or give you some idea of some things that I couldn't find anything or nobody really talked about. So that's kind of what I want to go through today. I'll start with my stats and everything first, so if you're just here to hear about that. So my highest weight was 385, and that was in September of 2014, September of 2014. That had been a year after I moved out to Los Angeles, coming from the East Coast, so I had gained almost 100 pounds, over 100 pounds actually, and just from the stress of grad school, the stress of moving, stress of leaving everybody on the other side of the country, and that was my highest weight. And my surgery consult weight was 335. I had lost about 50 pounds on my own, and then the day of surgery I weighed 331, and I had to do a 6-month pre-op period before I could have surgery. I'll do another video on that if anybody's interested in my whole experience with battling insurance and doing all that, but for now this is just my operation and all that. So today I weigh 321.6 pounds, which is 1 week post-op. So I am officially 1 week post-op. And that means I've lost 10 pounds already. Wow, that's crazy. It's probably because I'm not eating anything, but regardless, happy to say the least. So that's about it. I will hopefully keep you updated on my progress throughout me losing weight and moving on to different stages of my surgery and eating and all that. But for now, that's that. So for the rest of the video, just quickly, I wanted to talk about the things you can expect for the first week of after your weight loss surgery. And I'll talk a little bit about going into the hospital and all that too. So just to start out, I was super nervous. Like, I have never been hospitalized. I never had surgery, never been under anesthesia. Even for my wisdom teeth, they just sedated me like I was in Twilight or awake or whatever like that. So I had no experience with it. I was terrified I was going to wake up in the middle of surgery. I was terrified I was going to die, have a heart attack, and I got really bad anxiety. I had chest pains, which didn't help, right? Because I was like, should I have surgery? I don't know, I have chest pains. So anyway, on the day of surgery, I got there about 3 hours early. God knows why, because they had me sit there and wait for about an hour before anything even happened. And then, well, after that, it was like super fast. So they brought me back to this kind of like it's not a waiting area, it's like intake area. So each patient has their own little cubicle with a curtain, and you get your own pre-op nurse, and she was super nice. And she gave me this cute purple gown to change into and these cute purple socks with bear paws on them. So I changed into that, and she had me pee for a pregnancy test, which I'll get into the whole having to use the restroom issue later, but that's pretty personal as well with my experience. But anyway, I had to pee for my pregnancy test, which was negative, thank God. And then a nurse came in to start an IV, a different nurse, while the original nurse was asking me a bunch of questions, my medical history, etc., etc. Nurse started an IV. I didn't feel anything. They numbed my hand with lidocaine, which makes it numb. So I couldn't feel the needle or the tube going in, whatever. That was great. And then the anesthesiologist, I guess, one of the doctors came in and was talking to me. He was young, he was really nice, and he was saying, like, don't worry, I'm gonna give you something to calm you down, because everyone could tell I was like super nervous. And at that point there was like a line of people waiting to see me. I guess they had finished the first surgery earlier and they wanted to get me started. So he's like, you know, he's like, think of this as 2 glasses of your favorite wine, and boom, I felt 10 times better, and it's definitely some type of anxiolytic, but it made me feel great, and they wheeled me into the OR, and I just remember everyone chatting and talking to me, everyone was getting ready, and it gets really hazy at this point. I think they put an oxygen mask on me, and then the next thing I know, I was waking up with the most horrible pain. I know this is like not what you want to hear, but I'm being totally candid right now. The most horrible pain in my chest. It felt like an elephant was sitting on my chest, and I was like, please help me. Like, I remember hearing myself like, please help me. Like, I couldn't breathe. My throat was as dry as the desert. And they're like, and I was like, I can't breathe, I can't breathe. And the nurse is just like, your blood oxygen level is 97%, you're fine. And I was like, what? Like, that does not help, right? I was in so much pain. I realized now it was like gas and heartburn and all that lovely stuff combined. But so anyway, after, it felt like I was in recovery for like 5 minutes, but my boyfriend later told me it was like almost 2 hours in the PACU, or after you wake up from anesthesia. And so I must have just been in and out of consciousness that whole time. They finally got a morphine pump in me. Yeah, so that was nice. And then they rolled me to my room, which I got the beautiful corner suite of this wing in the hospital, which had this gorgeous window. But I realized later that I wish I had had one of the other rooms, because all the other rooms had like glass sliding doors, and mine just had a curtain, which was like, it was a really nice room, but I could hear everything. Like, the nurse's station was right outside, and they would, I'm not going to blame them, of course, I would talk if I was there for 12 hours a day, hell yeah, but I could hear them when I was trying to sleep, so, you know, that, I realized maybe I should have got one of the small, well, I wish I had gotten a smaller room with a door that closed, but regardless, I was, like, pretty much out of it the whole time I was there. So, in my room, in and out of consciousness, you know, I tried to be really conservative with my morphine use. All you do is hit the pump, and it kind of, you know, you've got morphine in you, and that's nice, but I didn't want to use too much of it. So my first tip is what to expect the first week, or even just the first day. Expect to be in pain, because from a lot of things that I'd read and a lot of things I've seen, people kind of breezed through this surgery. They didn't have any pain at all. It was great, yada yada, and that's fabulous. I'm happy for them, right? But that was not really the case for me, and I expected not to really be in pain. I expected it to be pretty mild. So while I was on morphine, didn't feel anything. It was great. I couldn't feel my abdomen at all. I had a lot of gas pain, but that's pretty typical. But once they switched me to oxycodone, oh my god, I was in so much, my cat, sorry, I was in so much pain, and I was just like, oh my god, what's happening? Is my stomach leaking? Is something wrong? Like, I did not expect it to be that painful. So, just tip number 1, expect to be in pain, because it's better for you to expect to be in pain and then be pleasantly surprised when you're not, as in when I was like, oh, it's totally going to be fine, not going to be pain, and then like be in pain and like be freaking out about it, right? So, I'm about 8 days out now. Yesterday was my 1-week post-op, and I am still in a little bit of pain, and I am out of oxycodone liquid. Lovely. I have like 1 dose left in there, if you can see that. I don't know. But, so yeah. My doctor's office stressed. Don't take the pain meds if you don't need it. I needed it. So just want to throw it out there as my experience. It was painful. It was painful. And it's not like horrendous, I can't move pain, nothing like that. Like, I can get up and walk in the hospital, I can get up and walk every day at home. It's just uncomfortable. So, the first day in the hospital, I also had no idea about this. You cannot drink water, anything, nothing. They will not let you have anything by mouth. So there's constant IV fluids going into you, great, but that's not the same as you have just been intubated from surgery, and your throat is so dry. Oh my god, please. I was like, they let you like swab your mouth, and I was like, let me suck on it, I need some liquid. But yeah, so I did not expect that. I thought I would be able to drink the first night, did not know that, so there you go, in case you had no idea. You cannot, well, my surgeon, you cannot drink the first night. So, and then another problem that I ran into the first night was that they want to make sure you can pee on your own, which you're like, oh, well, that's simple, right? Well, not for me. I'm the kind of person who I probably pee like 2 to 4 times a day for being max. Like I pee when I wake up, I pee when I get home from work, I pee before bed. That's pretty much it. I have a very big bladder. I have a very non-intrusive bladder. It's totally chill. It doesn't, I guess I hold a lot. Doesn't make me feel like I have to go to the bathroom. But the also issue is once I go to the bathroom, I don't have to go again. Like I physically cannot get anything out. Like I completely empty my bladder and that's it. I can't pee for another 6-8 hours. So they were coming in and they're like, you have to pee by 6 or they're gonna give you a catheter. And I was like, oh honey, no, like that, I do not want that. So I just kind of like kept putting it off. I kept telling them like, look, I'm not the kind of person who can pee a lot. And I haven't, literally, I have not consumed anything in over 12 hours, like water or liquid. And they're like, yeah, but you have IV fluids. I'm like, definitely not the same. It's only, I had like, what, 500 mils in me at that time, which is only like 30, not even 30 ounces, like not close. A couple cups, like, no, yeah, maybe like 2 or 3 cups of water, like, so that's nothing for me. I'm used to drinking over 100 ounces of water a day. So that was very stressful. So come like 11 p.m. I was finally able to pee, and they make you pee in this like boat, which is uncomfortable already. You gotta like sit on the toilet and you gotta pee in a boat. And I was just like, sorry if this is too much information, but I just want to let you know what you might expect at the hospital, okay? So finally I was able to pee, and then once I slept again for a few hours, I was able to pee a lot more. Usually when I sleep and wake up, gotta pee. So that was okay. Didn't have to get a catheter, but I just want to let you know that this was like really stressful on my psyche to be like, oh my god, I have to pee or they're gonna put a catheter in me, and that is a no bueno kind of thing. So that was another thing you might expect or might have to go through. And then in the morning of the second day, I was cleared to drink liquids, yay! And they brought me ice water, they brought me apple juice and chicken broth and beef broth. I tell you, all I drank was water. I was not hungry in the hospital at all. I tried some apple juice mixed with water, that was okay. I tried some grape juice mixed with water, that made me almost throw up. The chicken broth, was okay. My stomach could handle stuff, but it was like, it didn't really want to, so I just kind of stuck with water. They switched me on that second day off of my morphine pump and onto the liquid oxycodone. And then the surgeon came by and said, wow, your surgery went great. You can go home. And I was like, okay, don't really want to because I'm in pain. But yeah, so the gas pain had kind of dissipated once I was able to start drinking, which is kind of, I thought it was really weird, but once I could start drinking, it all broke up. And even when I was walking around, I walked around a ton the first day too, and that didn't even really help break it up. So it was really the second day when I could drink and eat, well, not eat, you know what I mean, that the gas started to break up. So I came home and I've been here ever since, relaxing, trying to heal, get better, sleeping on the couch, propped up with one of those big fluffy back pillows. And you know, it's been going, and I just wanted to hopefully put some of you at ease on what you can expect in the hospital, what you can expect before surgery. I don't think you'll remember anything. You will not wake up in surgery. They make sure of it. So that was my biggest fear. I hope maybe if any of you are anxious about that, that'll help you with that. But also, just before I go, I want to quick talk about what helped me in the hospital, and then what I've been using at home that's been helping me a lot here. So number one thing is, and I read this online, I just dropped it, but lip balm. Burt's Bees or EOS or whatever your favorite lip balm is, bring it to the hospital, because again, after they intubate you and they put that tube down your throat, you will want something on your lips are so chapped. That saved me, period. Bring lip balm to the hospital. Okay, tip number 2 is these gas X strips. I've seen a lot about these too. And I don't know if it was just my surgeon or my hospital or what, but I could not take these. I was not allowed to take these in the hospital. Even on the second day when I could take things through mouth, they did not want me to take these. I don't know what it was. They wanted me to work through the gas on my own, blah, blah, blah. So I could not take these in the hospital. Don't bother bringing them. Well, bother bringing them. They're great. But so to bring at your own risk, I could not use these in the hospital. I have been using them every day since. They are fantastic. They are the dissolvable mint flavored gas X strips. These help a lot. Even if they don't produce actual gas, you can definitely feel like a relief overall in your upper body. Oh, that's another thing. Don't be too worried if you feel pain in like your shoulders and your chest and your back. My surgeon explained that that's usually gas pain. Again, don't take that as 100% medical advice, but if you're extra worried about it, call your doctor, of course. Another thing, definitely do this incentive spirometer device, which is like you blow in it and the thing goes up, and it's to prevent pneumonia. Now, you do not want to get pneumonia after your surgery, believe me. So, I had like a little whiteboard in my room, and they said one of my goals was to do this 10 times every hour. Yeah, that did not happen, but I try to do it like 2 to 3 times a day. They put my mark at about 1,500 milliliters of air that I could blow. Yeah. And I've definitely been bypassing that, so I feel pretty good about that, but I am going to use it because you don't want to get fluid in your lungs, you don't want to get pneumonia, none of that. So make sure you do use that, bring it home with you, it is yours to take. And then I had really high blood pressure after the surgery. Now I have high blood pressure anyway, like I have hypertension, I take medicine for it, but after the surgery, it was like sky high. I mean, I consider it sky high. It was 160, 170, over 90, 100 at some point. So that's high. That's really high to me. So they couldn't get it down with medicine. I don't know what was going on with it, but they told me, make sure when you go home you buy one of these like self-monitoring blood pressure devices. It looks like this. I got one for my wrist because I don't know about you, but I have giant arms. And I can't buy those like, this fits normal people. No, it won't fit me. So I got one for my wrist to make sure it would fit me, and you just push the button, it takes your blood pressure. It's great. My blood pressure is totally under control now. I am on the same dose of hypertensive medication that I was before the surgery, but it is completely controlled, and everything's good with that. Also, my sugar went up in the hospital, so don't be too worried if that happens. I have completely normal sugar, and it was like 150 in the hospital. They had to give me a shot of insulin. It was so high. No idea, maybe because I hadn't eaten in a long time. I have no idea why that happened. But, so yeah. The first 3 days, what you can expect for, well, my experience is to be on full liquids. Now, clear liquids, I apologize. You can expect to be on clear liquids. Clear liquids are water, apple juice, grape juice. Make sure you dilute your fruit juices. I did have about half water, half fruit juice. And like chicken broth, beef broth, anything you can see through, sugar-free Jell-O, those are clear liquids. So that was the first 3 days. My surgeon's office says day 0 to day 3, which day 0 is your surgery day, then 1, 2, 3. So technically 4 days of that. And then after that, you're on full liquids, and it's important to start getting protein in. So I got these Premier protein shakes from Costco. They come in vanilla, chocolate, and strawberry. I like all 3 flavors. A lot of people say the chocolate's the best one. I like all 3. They're good. They are, if you can see, I don't know if you can tell, 30 grams of protein, 160 calories, not many carbs. Let's see, 4 carbs. That's great. It's 11 ounces, so it does take me a couple hours to actually get this down and drink it, but it has been definitely a great thing to have in my arsenal. So you can get those at Costco. Premier Protein is the brand. I picked them up on sale, $20 a case of 18, which is still like expensive. So you can expect to spend some money in the first week, or hopefully get this before your surgery. Get everything ready. I got these protein shakes. I got, the blood pressure thing was $50. My copay for surgery, which I did not expect, was $250. So if you didn't think about that either, your insurance, even though if you're doing an insurance and they cover it, it's kind of like going to the doctor's office. They cover you going to the doctor's office, but then you still got to pay $15, $20. And in this case, it was $250. So I was not expecting that. Hopefully that will help you out in that case. But what I also do is I keep a notebook. I didn't bring it over with me, but I keep track of everything that I eat and I drink and my medicines and what time I take them, because I can only take them every certain couple hours. So I think it's really important to have that kind of notebook where you keep track of everything. I think that is another tip I'd like to pass on. And then again, you can expect to lose weight. You might be a skeptic like I was, like, of course, yeah, I'm really heavy. I'm going to lose weight if I'm not eating anything, right? But just to lose 10 pounds in a week, it feels great. I know I'm not eating a lot of calories, and I know that's probably why, but just be excited about it. Let yourself be happy about the little things, but try not to weigh yourself too much. I have only weighed myself once a week. Again, I weighed myself yesterday. And I won't be weighing myself again until I go to my 2-week post-op appointment next week. And yeah, so enjoy that. Enjoy losing weight. Enjoy getting started on your journey. So expect to have some good things along with the pain and the gas and the, you know, all that. So yeah, I just wanted to hopefully get this out to people. Hopefully it helps someone. Let me know what kind of videos you'd like to see. I'll, of course, keep doing the updated every week or every month after that of my post-op experience, what you can expect, what I've gone through, hopefully to either get you started on your journey, help you along with your journey, or ease your fears if you're thinking about this type of surgery. So far, I am ecstatic that I was able to have it done and that I'm changing my life for the better. So I also do a ton of stuff. I like to cook, craft, what else? I don't know. I play video games. I do everything. So if you want to see anything cool, like maybe VSG friendly recipes, I can do stuff like that. Just let me know down below. I'd love for you to subscribe, come back and watch me through this journey. So leave a like if you like this type of video. Let me know if you want me to change anything. Stuff like that. I'd love to hear from you. I'd love to hear if you're going through this type of journey. Let me know down below, because I just would be happy to read other people's stories. So thank you so much for watching, and I hope to see